So treatment options for joint pain can really be broken down, I think, into four major categories. The first being what I would consider lifestyle modifications. So, the most important of which is activity modification, which is really just a fancy way of saying to avoid the things that hurt the joint that has pain. That can, for example, be avoiding running and jogging and exercising with swimming or biking, but avoiding the things that hurt. Weight loss can also be an important part of this, and physical therapy is traditionally also an important part of the lifestyle modification and trying to get a guided exercise program so that you can regain mobility and strengthen the joint, which ultimately helps reduce pain. The second option is oral medications, the workhorse of which are the nonsteroidal anti-inflammatory drugs, or NSAIDs. Examples of those are ibuprofen and naproxen. You can add Tylenol with either of those or any of the NSAIDs for some extra pain control because it works in a different way. And so really that's the most effective medication that we have is a nonsteroidal anti-inflammatory drug combined with Tylenol. The third option is a little more invasive. Those are joint injections. So basically you're putting a medicine into the joint to achieve pain control. The most common of which is going to be a steroid injection that decreases inflammation inside of the joint. Other options include things like what are called viscosupplementation injections, basically adding new lubricant into the knee. And it's important, at that point to, I think, consult with a surgeon so that the best injection, or you and your surgeon can discuss what the best injection is for you. And then the fourth option is really the most permanent and really the only way to reliably get rid of joint pain secondary to arthritis for good, which is joint replacement surgery. And obviously at that point, it's important to consult with a surgeon and see if that's appropriate for you. It's most important, in that last rung, when all of the other options aren't working, the medications, the therapy, the injections, that's really when it's time to start thinking about joint replacement surgery.